Assalamu alaikum everyone. A very warm welcome to all of you. I hope you all are doing well. Thank you for joining today's PMC certified Kinesio Taping workshop. My name is Dr. Mariam Tahir, Physiotherapist, Director of PMC, and I am really happy to have you all here. Today we are going to learn one of the most commonly used adjunct techniques in physiotherapy and sports rehabilitation, Kinesio Taping. Now before we begin, I want you to remember one important thing. Kinesio tape is not a magic tape. It is a clinical tool that should always be used after proper assessment and along with evidence-based physiotherapy treatment, not as a replacement therapy or not as a replacement for it, okay? During this workshop, I will explain the science behind Kinesio taping, when to use it, when not to use it, how to apply it correctly, and we will also go through practical applications for different body regions. Please feel free to note down your questions. We will have a question answer session at the end and I will be happy to answer them. Okay, if everyone is ready, let's get started with our first learning objectives and see what you will achieve by the end of this workshop. Okay, now let's look at what we are going to learn in today's workshop. The learning objectives. By the end of this session, my goal is that every participant should have a clear understanding of how and when to use Kinesio taping safely and effectively in the clinical practice. First of all, you will understand what Kinesio taping is and how it actually works. Many people think that tape itself cures pain, but that's not true. We will discuss the science behind it. Next, you will learn the indications, contraindications, and precautions. This is very important because not every patient is suitable for taping. As physiotherapists, we must always assess the patient before applying any treatment. After that, we will cover the basic principles of taping, including tape selection, skin preparation, tape tension. Okay. Basic principles of taping, including tape selection, skin preparation, tape tension, and application techniques. These fundamentals determine whether your taping will be effective or not. Then we will move to the practical applications. I will demonstrate taping techniques for common clinical conditions involving the shoulder, knee, ankle, neck, lower back and elbow, and explain the clinical reasoning behind each application. Finally, we will discuss some common mistakes that beginners often make and how you can avoid them to improve patient comfort and treatment outcomes. Okay, by the end of this workshop, you should feel confident in understanding the principles of Kinesio taping and applying it appropriately as part of an evidence-based physiotherapy rehabilitation program. Now that we know our objectives, let's start with the basics. What exactly is Kinesio taping? So, introduction to Kinesio taping. Okay, now let's start with the most important question, that what exactly is Kinesio taping? Many people have seen these colorful tapes on athletes during football matches, the Olympics or cricket and often think they are just for decoration, but that's not true. Kinesio taping is a therapeutic taping technique that uses a specially designed elastic cotton tape with a medical grade acrylic adhesive. It is applied to the skin to help reduce pain, improve movement, support muscles and joints, and enhance proprioception without restricting normal range of motion. Unlike traditional rigid sports tape, Kinesio tape is elastic. It can stretch up to about 140 to 160% of its original length, which is very similar to the elasticity of human skin. Because of this, patients can move comfortably while wearing it. Now, you should know that Kinesio tape is an adjunct treatment, not a primary treatment. This means it should always be combined with proper physiotherapy management, such as patient assessment, therapeutic exercises, manual therapy, education, and rehabilitation. The technique was developed by Dr. Kenzo Case, a Japanese chiropractor, in the 1970s. His goal was to provide support while allowing normal movement, unlike rigid athletic taping that restricts motion. Today, Kinesio taping is widely used in sports physiotherapy, orthopedic rehabilitation, neurological rehabilitation, pediatric physiotherapy, geriatric rehabilitation, and post-operative rehabilitation. However, one important thing to remember is that the tape itself does not heal the injury. It simply creates an environment that may help reduce pain, improve muscle function, support movement, and assist the rehabilitation process. So don't think of Kinesio tape as a cure. Think of it as a clinical tool that supports your overall treatment plan. Okay, now that we know what Kinesio taping is, the next question is how does it actually works? Let's move to the mechanisms of action in the next slide. This is one of the most commonly asked questions by both students and patients. Some patients even ask, "Doctor, how can a simple tape reduce my pain?" The answer is that the tape itself doesn't cure the injury. Instead, it creates several physiological effects that support the body's natural healing process. Let's understand these mechanisms one by one. First is pain modulation. Here, first of all, Kinesio tape may help reduce pain by providing continuous stimulation to the skin. This sensory input can influence the nervous system and may reduce the perception of pain. Many researchers explain this using the gate control theory of pain, where stimulation of skin receptors can decrease pain signals reaching the brain. So, patients often report feeling more comfortable soon after the tape is applied. Second is muscle facilitation or inhibition. Now, another important function is muscle support. Depending on how the tape is applied, its direction, tension, and placement, it may help facilitate weak muscles or reduce overactive muscle activity. This is why proper assessment is so important before deciding on the taping technique. Third is improved proprioception. Next is proprioception, which means the body's awareness of its position and movement. The tape continuously stimulates the skin, giving the brain additional sensory feedback. This may improve movement awareness, joint control, coordination, and balance, especially during rehabilitation and sports activities. Fourth is lymphatic and circulatory effects. Another proposed benefit is improving lymphatic drainage. When the elastic tape gently lifts the skin, it may create a small amount of space between the skin and underlying tissues. This may help improve blood circulation and lymphatic flow, which can assist in reducing swelling, bruising, and edema. Fifth is joint support. Finally, Kinesio tape provides gentle support to muscles and joints without restricting normal movement. Unlike rigid athletic tape, it allows patients to continue functional activities while still receiving support. Now, you should remember one important point. The effectiveness of kinesio taping depends on several factors: proper patient assessment, correct tape selection, appropriate tension, accurate application technique, and combining tape with an evidence-based rehabilitation program. Okay, so kinesio tape is not magic. It works by supporting the body's natural healing mechanisms and should always be used as part of a comprehensive physiotherapy treatment plan. Now that we have understood how it works, let's move on to the next slide and discuss the indications. When should we actually use kinesio taping? This is where your clinical reasoning becomes important. Remember, we don't apply kinesio tape just because a patient has pain. First, we perform our proper assessment, identify the cause of problem, and then decide whether taping is appropriate or not. Okay, let's discuss the common indications one by one. First is musculoskeletal pain. The most common indication is musculoskeletal pain. For example, patients with shoulder pain, neck pain, low back pain, knee pain, or elbow pain may benefit from kinesio taping as part of their rehabilitation program. The tape may help reduce pain, improve movement, and increase patient confidence during daily activities. Second is sports injuries. Now, kinesio taping is widely used in sports physiotherapy. Athletes with muscle strains, ligament sprains, overuse injuries, or tendon problems often use kinesio tape during training or rehabilitation. It provides support while still allowing normal movement, which is why many athletes prefer it over rigid sports tape. Third is edema and swelling. Another important indication is edema or swelling. Using the lymphatic tape technique, we may help improve lymphatic drainage and reduce mild swelling or bruising after injury or surgery. However, remember that this should only be done after proper assessment and when there are no contraindications. Okay, so fourth is postural dysfunction. Kinesio tape can also be used for postural correction. For example, patients with rounded shoulders, forward head posture, or poor sitting posture may benefit from taping as a reminder to maintain better alignment. But remember, the tape is only a reminder, not a permanent solution. Posture correction should always include strengthening exercises and patient education. Fifth is muscle facilitation or inhibition. Sometimes a muscle is weak and needs support, while other times it is overactive and needs to relax. With the correct taping technique, we may facilitate weak muscles or inhibit overactive muscles depending on the patient's clinical presentation. Sixth is neurological rehabilitation. Finally, kinesio taping may also be used in neurological rehabilitation. For some patients with conditions such as stroke or cerebral palsy, taping may help improve proprioception, posture, and movement control as part of a comprehensive rehabilitation program. However, you should know that evidence varies depending on the condition. So, we should always use clinical judgment and current evidence when deciding to tape. Okay. Key take home message is that the important thing to remember is that kinesio taping is indicated for selected patients and selected conditions. It is not a universal treatment for every patient with pain. Okay. Always ask yourself, what is the patient's problem? What is my treatment goal? Will kinesio taping actually benefit this patient? If the answer is yes, then it can be an excellent adjunct to your physiotherapy treatment. Okay, now we know when to use kinesio taping, but just as important is knowing when not to use it. So let's move to the next slide and discuss the contraindications and precautions. As healthcare professionals, our first responsibility is patient safety. Before applying any tape, you should always ask yourself, is it safe for this patient? If the answer is no or you are unsure, don't apply the tape until you have reassessed the patient. Let's go through the main contraindications and precautions. First is open wounds or skin injuries. First of all, never apply kinesio tape over open wounds, cuts, burns, stitches or infected skin. The tape can irritate the damaged tissue, increase discomfort, and may delay healing or increase the risk of infection. Always wait until the skin has healed before considering taping. Second is skin allergy or sensitive skin. Some patients may have an allergy or sensitivity to the acrylic adhesive used in the tape. Before a full application, it's a good idea to perform a patch test, especially if the patient has never used kinesio tape before. If the patient experiences redness, itching, burning or rash, remove the tape immediately. Okay. Third is deep vein thrombosis, DVT. Now this is very important contraindication. If a patient has a suspected or confirmed deep vein thrombosis, do not apply kinesio tape over that area. Increasing circulation through a blood clot could be unsafe. Such patients require immediate medical evaluation, not taping. Okay. Fourth is active infection. Avoid applying tape over areas with cellulitis, fungal infections, or any other active skin infection. Treat the infection first. Once the condition has resolved, you can reassess whether taping is appropriate. Fifth is malignancy, cancer. Okay. Avoid applying kinesio tape directly over a non-malignant tumor unless specifically recommended by the treating medical team. Patient safety and multidisciplinary communication are very important. Okay, patient safety and multidisciplinary communication are very important in these cases. Okay. Sixth is pregnancy, used with caution. Pregnancy is not an absolute contraindication, but extra caution is required. Certain taping techniques may help with low back pain or postural support during pregnancy, but they should only be used after proper assessment and within your professional scope of practice. Always perform a skin assessment. Before every application, examine the skin carefully. Look for cuts or wounds, rashes, bruising, skin irritation, signs of infection, excessive hair or oily skin that may affect adhesion. The skin should be clean, dry and intact before applying the tape. Okay, you should remember one simple rule. Assessment comes first, tape comes second. Never apply kinesio tape without checking the patient's medical history, skin conditions and overall clinical presentation. A skilled physiotherapist doesn't just know how to tape, they know when to tape, when not to tape and why. Now that we have covered safety, let's move on to the next slide and learn about the different types of kinesio tape, tape shapes and the basic preparation before application. Many beginners focus only on the application technique, but proper preparation is just as important. Even the best tape technique may fail if the skin isn't prepared correctly. Okay, first is types of kinesio tape. First, let's talk about the tape. Kinesio tape is made of elastic cotton fabric with a medical grade acrylic adhesive. It is designed to mimic the elasticity of human skin, allowing patients to move comfortably without restricting joint motion. You may notice tapes in different colors such as blue, black, beige, pink or red. Okay. Now a common question is, does the color make any difference? The answer is no. Scientifically, all colors have the same function. The color is mainly a matter of patient preference or clinic availability. There is no strong scientific evidence that one color works better than other. Second is tape shapes. Now, depending on the treatment goal, we cut the tape into different shapes. The most common shapes are I strip, used for simple muscle support or pain relief. Okay. Y strip, used to surround or support larger muscles. X strip, useful for muscles that change length significantly during movement. Fan strip, commonly used for edema or lymphatic drainage. Web strip, also used to help manage swelling. Choosing the correct shape depends on the muscle, joint and treatment objective. Third is skin preparation. Okay, before applying the tape, always prepare the skin properly. The skin should be clean, dry, free from oils, lotion or sweat. Okay, if the patient has excessive body hair, trimming the hair may improve tape adhesion and make tape removal more comfortable. Also, inspect the skin carefully for any cuts, rashes, redness or irritation before application. Fourth is tension principles. Now, one of the biggest mistakes beginners make is applying too much tension. You should know that more stress doesn't mean better results. Different techniques require different amounts of tension. For example, 0% tension is commonly used for the anchors. Light tension may be used for pain relief or lymphatic techniques. Moderate tension is often used for muscle support, and high tension is used selectively for ligament or mechanical correction techniques and only when clinically indicated. Always follow the purpose of the application rather than using the same tension for every patient. Okay, remember these 4 steps before every application. Choose the correct tape. Select the appropriate tape shape. Okay, select the appropriate tape shape. Prepare the skin properly and apply the correct amount of tension. Always remember these 4 steps. Okay, correct tape, appropriate tape shape, prepare the skin properly and then apply the correct amount of tension. If you get these basic right, your taping will be more comfortable, more effective and longer lasting for the patient. Now that we have know how to prepare the tape and the patient, let's move on to the next slide where we will learn the basic principles of applying kinesio tape correctly. Many people think applying the tape is easy. They simply copy what they see on YouTube or social media. But as physiotherapists, we should understand why we are applying the tape, not just how. A good application depends on following a few basic principles. First is patient position. First of all, position the patient correctly. The muscle you are going to tape should usually be placed in a slightly stretched position. This helps the tape work more effectively once the patient returns to a normal resting position. So don't rush. Proper positioning is the first step. Second is anchors. Now let's talk about the anchors. The anchor is the beginning and the end of the tape. One important rule you should always remember is never stretch the anchors. The first and last 2 to 3 centimeters of the tape should be applied with 0% tension. This reduces skin irritation and helps the tape stay in place for a longer time. Third is direction of application. The direction depends on your treatment goal. For example, you may use one direction when you want to facilitate muscle activity and another when your goal is to reduce excessive muscle activity. So always decide the direction based on your clinical assessment, not by habit. Fourth is tape tension. Now let's discuss tension. This is where many beginners make mistakes. Remember this simple sentence. More tension doesn't mean better results. Different conditions require different amounts of stretch. Sometimes no stretch is needed, sometimes light tension is enough, and only certain techniques require moderate or higher tension. Always follow evidence-based guidelines and your clinical reasoning. Fifth is activate the adhesive. After applying the tape, gently rub it with your hand for a few seconds. The warmth generated by friction helps activate the acrylic adhesive, allowing the tape to stick better to the skin. This simple step improves the durability of the application. Sixth is patient education. Now, your job doesn't end after applying the tape. Always educate your patient. Tell them the tape can usually stay on for 3 to 5 days, depending on the product and skin condition. They can shower normally but should gently pat the tape dry instead of rubbing it. If they experience severe itching, burning, skin irritation or an allergic reaction, they should remove the tape immediately and contact you. Patient education is just as important as the application itself. Okay, let's quickly revise the basic principles. Position the patient correctly. Never stretch the anchors. Choose the correct direction. Apply the appropriate amount of tension. Activate the adhesive by rubbing the tape. Always educate your patient after application. If you consistently follow these principles, your taping technique will be safer, more effective, and more professional. Now that we have learned the application principles, let's move on to the practical session and start with one of the most common application, Kinesio Taping for the shoulder. Shoulder pain is very common in our clinical practice. We see patients with rotator cuff injuries, shoulder impingement syndrome, muscle strain, posture problems, and sometimes adhesive capsulitis. Now, before you even think about applying the tape, always assess the patient first. Ask yourself, what is the diagnosis? Which muscle or structure is involved? What is my treatment goal? Remember, we don't tape our diagnosis. We tape according to the patient's clinical findings. When can we use shoulder taping? The question arises that when can we use shoulder taping? Shoulder kinesio taping may be helpful for firstly rotator cuff dysfunction, shoulder impingement syndrome, thirdly deltoid muscle strain, fourth mild shoulder instability, fifth postural shoulder pain, sixth muscle fatigue during sports or rehabilitation. Again, the tape is an adjunct treatment, not the main treatment. Okay, so what would be the application technique regarding this? Okay, let's look at the basic application first. First, ask the patient to place the shoulder in a comfortable stretched position depending on the muscle you are targeting. Usually, we will use a wide strip to support the deltoid muscle. Start by applying the anchor with no stretch. Then guide the tape around the anterior and posterior parts of the deltoid using the appropriate amount of tension. Finally, apply the ending anchor with 0% tension. After the application, gently rub the tape to activate the adhesive. So, what are the expected benefits? If applied correctly, shoulder tape may first help reduce pain, secondly, improve proprioception, thirdly, support the shoulder during movement, fourthly, increased patient confidence while performing daily activities, fifthly, remind the patient to maintain better shoulder mechanics. However, you should know the tape will not repair a torn tendon. Okay, you should always know that the tape will not repair a torn tendon or heal a structural injury. It simply supports the rehabilitation process. So, what are the clinical tips regarding this? Here are a few practical tips. Always clean and dry the skin. Avoid excessive tension because it may cause discomfort or skin irritation. Thirdly, check the patient's comfort immediately after application. And fourthly, ask the patient to move the shoulder through its range of motion to ensure the tape feels comfortable and does not restrict movement. So these are the 4 clinical tips that you have to follow, okay, that you have use in your practical performance. Okay, these are the few tips. Okay, that always clean and dry the skin before applying the tape. Secondly, avoid excessive tension because it may cause discomfort or skin irritation. Thirdly, check the patient comfort immediately after application. Fourthly, ask the patient to move the shoulder through its range of motion to ensure the tape feels comfortable and does not restrict movement. Okay, so remember this. A successful shoulder taping application starts with a proper assessment, followed by the correct tape shape, correct tension, and correct technique. Okay, the goal is to support movement, reduce pain, and improve function, not to immobilize the shoulder. Okay, Now that we have covered shoulder taping, let's move on to the another slide that is very common clinical conditions. We will discuss there, okay? Kinesio taping for the knee. Knee pain affects people of all ages. We see it in athletes, office workers, older adults, and even young patients. Office workers, older adults, and even young patients who are physically active. Now, before applying kinesio tape, remember the same principle we discussed earlier. Assessment comes first, taping comes second. Identify the cause of the pain before deciding on the taping technique. When you can use knee tapping, okay? When can we use knee tapping? The question arises. Kinesio tapping may be helpful in conditions such as patellofemoral pain syndrome, mild ligament sprains, quadriceps muscle strain, patellar tendinopathy, that is jumper's knee, osteoarthritis as an adjunct for pain management, mild swelling around the knee. Okay. Remember, the tape is not a replacement for strengthening exercises or rehabilitation. Okay, it simply supports the treatment plan. Application technique we will discuss now. Okay, let's see the basic application. First, ask the patient to sit comfortably with the knee slightly bent, about 30 to 45 degrees of flexion. For patellofemoral pain, we commonly use an I-strip or Y-strip, depending on the treatment goal. Start by applying the ankle below or above the knee without any stretch. Then guide the tape around the patella or along the quadriceps muscle using the appropriate amount of tension. Finally, apply the ending anchor with 0% tension. After completing the application, gently rub the tape to activate the adhesive. So what are the expected benefits? When applied correctly, knee tapping may help reduce pain during walking or climbing stairs, improve patellar tracking in selected patients, enhance proprioception and joint awareness, provide gentle support without limiting knee movement, increase patient confidence during functional activities. So what are the clinical tips? Now let me share a few clinical tips regarding knee. Okay, few practical tips may include: always check the patient's knee alignment before tapping, avoid applying excessive tension over the kneecap, ask the patient to walk, squat, or perform a few functional movements after tapping. If the patient feels increased pain or discomfort, reassess your application rather than simply adding more tape. Okay, remember, more tape does not mean better treatment. Correct technique is what makes the difference. Okay, so the main goal of knee kinesio taping is to reduce pain, improve movement, and provide functional support while allowing normal range of motion. It should always be combined with strength exercises, flexibility training, patient education, and an evidence-based rehabilitation program. Now that we have learned about knee tapping, let's move on to another common application in clinical practice, that is kinesio tapping for the ankle. Ankle injuries are among the most frequent musculoskeletal injuries, especially in athletes and physically active individuals. The most common condition we see is a lateral ankle sprain, but kinesio taping can also be used as part of rehabilitation for other ankle-related problems. Again, before applying the tape, always perform a proper assessment. Ask yourself which ligament or muscle is injured. Is there swelling? Is the injury acute or chronic? What is my treatment goal? Only after answering these questions should you decide on the tapping technique. So the question arises, when can we use ankle tapping? Kinesio taping may be helpful for lateral ankle sprains, mild ankle instability, Achilles tendon irritation, peroneal muscle strain, swelling around the ankle, support during return to supports. Okay, remember, the goal is to support movement, not to completely immobilize the ankle. Okay, so the application technique, let's look at the basic application. Ask the patient to sit comfortably with the ankle in a neutral position or slight dorsiflexion. Depending on the condition, an I strip or Y strip is commonly used. Begin by applying the ankle with 0% tension, then guide the tape along the muscles or around the ankle joint using the appropriate amount of stretch. Finish with another ankle applied without tension. Finally, rub the tape gently to activate the adhesive. So, what are the expected benefits? When applied correctly, ankle tapping may help reduce pain during walking and daily activities, improve proprioception and balance, provide gentle support to the injured tissues, increase the patient's confidence while moving, assist rehabilitation when combined with exercises. So, what are the clinical tips? Now, here are a few practical tips. If there is significant swelling, consider using a fan strip to assist lymphatic drainage. Do not apply the tape too tightly as this may affect comfort and circulation. After taping, ask the patient to walk a few steps and check whether the tape feels comfortable. Always reassess pain and function after the application. Remember, the patient's feedback is very important. Okay, if they feel increased discomfort, numbness, or excessive tightness, remove the tape and reassess your technique. Okay, you should remember that kinesio taping for the ankle is meant to provide functional support while allowing normal movement. It is not a substitute for ligament healing, balance training, strengthening exercises, or proprioceptive rehabilitation. It should always be part of a comprehensive physiotherapy treatment plan. Okay. Now that we have covered ankle tapping, let's move to our next application, that is kinesio tapping for the lower back. One of the most common complaints we see in clinical practice. Before we finish, I want to discuss something that can make a big difference in your clinical practice, the common mistakes that many beginners make. Even if you know the technique, small mistakes can reduce the effectiveness of the tape or even make the patient uncomfortable. Okay, let's go through them one by one. First is skipping the assessment. The biggest mistake is applying tape without assessing the patient. Some clinicians see pain and immediately apply tape. Remember, pain is a symptom, not a diagnosis. Okay, always assess the patient first, identify the cause, and then decide whether kinesio taping is appropriate. Okay, second is applying too much tension. Another common mistake is using too much stretch. Many beginners think tighter tape provides better support, but that's not true. Excessive tension can cause discomfort, skin irritation, blistering, and poor results. Always use the minimum tension needed for your treatment goal. Okay, third is stretching the anchors. This is another mistake I see very often. Remember our basic rule. The anchors should always applied with 0% tension. Okay, stretching the anchors may cause the tape to peel off early and increase the risk of skin irritation. Fourth is poor skin preparation. Sometimes the tape doesn't stick simply because the skin wasn't prepared properly. Before every application, clear the skin, dry it completely, remove excessive oil or lotion, trim excessive hair if necessary. Good preparation improves adhesion and patient comfort. Okay. Fifth mistake the most clinicians do is ignoring patient feedback. Now, after applying the tape, don't just say, okay, you are done. Ask your patient, does the tape feel comfortable? Is there any itching or burning? Can you move normally? If the patient feels pain, numbness, or excessive tiredness, remove the tape and reassess your technique. Always listen to your patient. Okay. Sixth is relying only on kinesio tape. Finally, one of the biggest clinical mistakes is thinking that kinesio taping alone will solve the patient's problem. It won't. The best results come when taping is combined with therapeutic exercises, manual therapy when appropriate, patient education, activity modification, a structured rehabilitation program. Think of kinesio tape as one tool in your physiotherapy toolbox, not the entire treatment plan, okay? Let's quickly summarize the mistakes to avoid. Never skip the assessment. Don't apply excessive tension. Never stretch the anchors. Prepare the skin properly. Always listen to your patient's feedback and never rely on tape alone. If you avoid these common mistakes, your taping will be safer, more effective, and much more professional. Now we have reached the final part of today's workshop. In the next slide, we will summarize the key learning points and then move to the question answer session. Okay, now let's apply everything we have learned to a real clinical case. This is the most important part because in clinical practice we don't treat slides, we treat patients. Let's imagine a patient comes to your clinic. Okay, let's imagine a patient comes to your clinic. Case scenario is a 28-year-old female presents with right shoulder pain for the last 3 weeks. She is an office worker and spends around 8 to 10 hours daily working on a computer. Okay, she complains of pain while lifting her arm overhead and difficulty carrying heavy objects. On assessment, pain is 5 out of 10 on the pain scale. Okay, shoulder range of motion is slightly limited because of pain. Muscle strength is slightly reduced. No history of fracture, dislocation, or recent surgery. Okay, skin is healthy with no allergies or contraindications. Okay, now I want all of you to think like physiotherapists. Don't think about the tape first. Okay, ask yourself, what is the problem? What is my treatment goal? Is kinesio taping appropriate for this patient? Take a few seconds and think about it. Okay, now based on this assessment, yes, kinesio taping can be considered because there are no contraindications and our goals are reduce pain, improve shoulder movement, provide gentle muscle support, increase the patient's confidence during daily activities. Okay, so we may apply an appropriate shoulder taping technique, but we will not stop there. Remember, a complete treatment plan should also include patient education, posture correction, rotator cuff strengthening exercises, scapular stabilization exercises, stretching of tight muscles, and ergonomic advice for computer work. Okay, this is what we call an evidence-based physiotherapy approach. Okay, now let me share a few important clinical tips with you. Never tape every patient with the same technique. Every patient is different, so your assessment should guide your treatment. Reassess the patient after taping. Ask them to move the shoulder and see if there is any improvement in pain or function. If the tape is not helping, don't just apply more tape. Re-evaluate your assessment and treatment plan. Okay, the biggest lesson from this case is simple. Assessment, then clinical reasoning, then treatment selection, and then reassessment. Okay, this is the sequence every physiotherapist should follow. Kinesio taping is not the first step and not the final step. Okay, it is one of the component of a comprehensive rehabilitation program. Okay, it's a one component of a comprehensive rehabilitation program. Now we have completed that teaching part of today's workshop. Let's move to our final slide where we will summarize everything we have learned, and then we will answer your questions during the question answer session. So we have reached to the final slide of today's workshop. First of all, I would like to thank each one of you for your active participation and attention throughout the session. Let's quickly revise the most important points we learned today. Today we discussed what kinesio taping is and how it works, the mechanisms of action including pain modulation, proprioception, muscle support, and lymphatic effects. The indications and contraindications for taping, different types of tape shapes, and skin preparation. The basic principles of application, including anchors, tape tension, and patient education. Clinical applications for the shoulder, knee, ankle, and lower back. The common mistakes to avoid. And finally, we discussed a clinical case to understand how to apply clinical reasoning in practice. Now, I want you to remember one important message from today's workshop. Kinesio taping is not a treatment on its own. It is an adjunct technique that supports rehabilitation, okay? The best outcomes are achieved when taping is combined with proper assessment, evidence-based exercises, manual therapy when indicated, patient education, and regular follow-up, okay? As physiotherapists, our responsibility is not just to know how to apply the tape, but also when, why, and when not to use it. Always let your clinical reasoning guide your decisions rather than applying tape routinely to every patient. As you begin practicing kinesio taping, don't worry if your first application isn't perfect, okay? Every skilled clinician improves with practice. Keep assessing your patients, keep learning from each case, stay updated with current research, and always prioritize patient safety first, okay? That is what makes an excellent physiotherapist, okay? So now it's your turn, all the students. If you have any questions regarding the theory, assessment, taping techniques, or clinical applications, feel free to ask in the comment section, okay? I will be happy to answer your questions and discuss any clinical scenarios you have. Thank you once again for joining the PMC certified kinesio taping workshop. I wish you all the best in your clinical practice. Keep learning, keep growing, and most importantly, always provide evidence-based patient care. Thank you everyone. Assalamu alaikum and have a wonderful day. Allah Hafiz.